y'all hear me in the back okay? Yes? Okay, my apology. Great. Well, it's my pleasure to welcome you all here tonight and to thank you for welcoming me. It's great to see so many of you here. You're being handed something right now because at this point you know a great deal more about me than I know about you. So what I'm going to ask you to do, please don't press any buttons yet. If you press a button now, you may elect a Republican senator from Alaska or a Democrat from Louisiana, but either way there'll be no paper record. So please don't press any buttons until I tell you what to do. And this is just a sort of a test, this first question. When you get the signal, if you're an ETSU student, you will press 1. I kept that one simple for the students. If you're faculty or staff, press 2. If you're an alum, press 3. If you're a member of the general public, press 4. And if you're something else, press 5. When you press the button, you'll see a little green light illuminate. When you lift your finger off the button, that light will stay lit. When it stops being lit, your vote is going to be registered. So let's go ahead. Press 1, 2, 3, 4, or 5 now. And I can tell you how many people are voting. We've got 95, 96, 97, 99, 101. The number's still rising. I will tell you, if you vote more than once, it'll eliminate your first vote. 110, the number's still going up. 112. See, actually what this is, at the end I'm going to do the same thing again. I'll know how many of you slipped out during the presentation. 115. Do I hear 116? Okay, here we go. All right, so 61% of you are students, 24% are faculty, 2% are alums, 8% are general public, and 5%, about 6 of you are something else. I know all of you think you're something else, but for purposes of tonight, this is helpful to me because it now lets me know that I'm talking to the students. I need to talk at a slightly higher level and provide more useful information than I would have had I been talking to some other group. Now, between the talks, don't press the buttons, okay? Because again, you may change the outcome of history. All right, I want to do 3 things tonight. I want to inform you, I want to involve you, and I want to motivate you. I want to inform you about some of the leading health challenges that the world faces. Let me say 2 things about this. 1, I'm going to show you a lot of statistics, a lot of numbers. Don't worry about them. Don't write them down. You can find them all on the internet. The important thing isn't the exact number. The important thing is the concept that the number is trying to communicate to you. That's point 1. Point 2, don't worry. I'm not going to show any graphic pictures of people in extreme conditions. I know they do that sometimes when you're talking about global health issues. I'm going to show a couple of pictures of the environment in extreme conditions, but not people. Secondly, I'm going to involve you. I want to involve you in thinking about these issues, both tonight by using this interactive clicker system, but also when you leave, I want you to go home and I want you to think about what you saw and I want you to ask some questions. And I want you to say, well, gee, I don't think that's quite right, or where did that number come from, or 109 million what? And so that's part of the thinking about it. Motivation. Obviously, the most important thing is I want to motivate you to do something about some of these global health issues. That's goal number 1. That's why I'm here. Now, I will confess to having a secret objective that only applies to the 61% of you who are students. And I hope that some of you will consider a career in public health. I hope at least 3 of you come up to me afterwards and say, you know, I kind of like that stuff you talked about. I think that's kind of interesting. And maybe that would be something I would find personally and professionally rewarding. And so I hope some of you come to me afterwards and say that. So, the greatest challenge in global health. Before I talk about it, I want to acknowledge the help of a couple of people. First of all, Mr. Wykoff Lawson, sitting in the front row here. Wyeth has been essential in helping me put together some of the statistics as well as some of the graphics. And Wyeth, I'm sure you'd be happy to share with everyone here what it's like to be a public health student. Yes? He said he'd be pleased to. He can't think of anything he'd rather do tonight. Dr. Mike Stutz, a faculty member in the department. Now, hold your applause for later when I'm done. I'll appreciate it more then. Mike has also been very helpful in helping me put together both some of the graphics and some of the statistics and the slide presentation itself. Mr. Ralph Lilly, who none of you know, is a good friend of mine up in Maryland. He's passionate about one of the issues I'm going to talk about tonight. He provided a lot of the statistics on that, and so in his absence, I'll tell you about that. And then Dr. David Curry and Ms. Myra Jones from ATS, who've been absolutely essential in making this clicker system work for us. All right. Also, Cynthia Taylor is here. Cynthia, where are you? She's helped put together the reception. And then most importantly, two of my sons, Grant and Gregory. You'll see their pictures frequently in the slide presentation, particularly when I'm talking about horrible, disfiguring conditions. Gregory said after I said that, I have to tell you that, in fact, I'm not talking about genetics. The greatest challenge in global health. Well, let's start with a little bit of an overview. Today in the world, there's about 194 sovereign nations, about 24 other territories and colonies. There's about 6.5 billion people, and every year there's about 136 million births. We describe the people on the earth a lot of different ways. We describe them from where they're from. I'm an American. I'm a Ugandan. I'm from India. We describe them in the region. I'm a North American. I'm an Asian. I'm an African. We describe them by race. We describe people by ethnicity. We describe people by religion. But for purposes of tonight's discussion, I want to set all of that aside, and I want to talk about us as a species, all of us together. What are the greatest challenges we as human beings face on the earth today? It makes sense, but it's actually very difficult. It's especially difficult for people from the United States because so much of the way we have learned about the world is an us and they. Here are the issues for the United States. Here's global health. Global health is something that affects everybody else. But it's really essential that to understand the greatest challenges facing global health today, you've got to be able to set aside this difference between us and them. And to do that, that's so important to me that to do that, I'm going to go through the next set of slides doing something other than what I'm supposed to be talking about tonight. And what I want to do is talk to you about the health status of the United States, solely for the purpose of getting you to separate out this concept of us and them. Because if you don't do that, we can't go forward. When you describe the health status of a country, there's lots of different ways, but traditionally in public health we use two measures: life expectancy and infant mortality. Life expectancy, of course, measures every single factor that impacts on someone's life. How healthy is the mother when she gets pregnant? Is that baby born in a safe environment? Is that baby able to survive the first 30 days of life when most people die? Is that baby able to grow up with adequate food and water, safe sanitation, and so on? Does that child live in a world free from war, famine, and civil strife? When that person gets sick, can they access health care? All of those factors go into life expectancy. So it is the most global measure of the health of a nation. And how does the United States do for life expectancy? In 2006, the life expectancy of a baby born today in the United States is 77.85 years. That's the longest it's ever been. In 1900, it was about 42 years. So in the course of a century, we've almost doubled the life expectancy in this country. Absolutely phenomenal. But now you get a chance to vote again. So get your clickers ready. Don't press any buttons. But where do you think the U.S. is ranked in the world? If you think we're in the top 5, you're going to press 1, but not yet because we're not voting. 2 if you think it's 6 to 10. 3 if you think we're 11th to 15th. 4 if you think we're 16 to 20th. And 5 if you think we're worse than 20th for this basic fundamental measure that measures the totality of health of a nation. Let's go ahead and vote now. 106, 110, 100, you're getting good at this, 118. Oh, there's more voting now than voted before. So many of you don't have an identity. The psychology department would be happy to have you study with them. 125, okay. Well, that's good enough. And let's see what you thought. Most of you thought that the U.S. was in the top 5 or 6 to 10, so over half of you there. And then it dwindled out. And then there's about 16% of you that thought we were worse than 20th. Does that all make sense to everybody? The Gen Ed math courses do well, Dr. Bach, thank you. All right, well, what's the reality? In 2006, life expectancy in the United States ranked behind all of these countries, including Bosnia, Jordan, Singapore, Sweden, Switzerland, United Kingdom. And so for this basic measure of health, In 2006, in the United States, we ranked 29th. 2.5 dozen other countries that do better at this basic fundamental measure of health than does the United States. And I can't pass up an opportunity to mention Tennessee. We rank 45th in the nation. If we were an independent sovereign country, we would be 52nd in the world, behind countries like Albania, Cuba, Panama, Saudi Arabia, Mexico, and so on. This is not an exercise nor a lecture in trying to be critical or trying to analyze. What I'm trying to get you to do is to separate the we from the them. That is absolutely essential. Now, infant mortality is a little more technologically sensitive. It is the number of babies that will live to 1 year of age for every 1,000 babies born alive. And it, of course, it more intensively measures the health of the mother. How healthy is she before she gets pregnant? Does she use addictive drugs like nicotine or alcohol or other substances? Is she well nourished during pregnancy? Is that baby born in a safe environment? Is that baby kept warm and fed and healthy during the first 28 days, and so on and so forth? And in the United States in 2006, our infant mortality rate was 6.43. That's how many babies will die in the first year of life for every 1,000 babies born alive. That is the lowest number we've ever had in the United States. In 1900, that number was 100. It's gone down over 90% in the course of a century. Tremendous improvement reflecting in the overall health improvements in the United States. And now you get to vote again. So where do you think the U.S. is ranked in infant mortality? Now remember, these are different. Infant mortality and life expectancy measure different kinds of things. So you can vote 1 if it's top 5, 2, 6 to 10, 3, 11 to 20, 4, 21 to 30, and 5 over 30. Okay, let's vote. Wow, you're voting fast. If I get over 125 votes, I know we really are in Louisiana. I lived there for many years, I can say that. That's, as Rebecca said, I went to Tulane for 9 years. They finally got rid of me. Okay, we stopped at 123. Anyone else want 124? One more person care to vote? Okay, let's see how we did. All right, here again, most of you put us sort of in the middle. A few top 5, 6 to 10. 3/4 of you say we're less than 30th. 9% say we're worse. Well, let's see where we were in 2006. Infant mortality in the United States ranked behind all of those countries, including South Korea, Cuba, and Taiwan, among others. We ranked 34th in the world. Almost 3 dozen other countries do better at this basic measure of health than does the United States. Tennessee ranks 48th in the nation. If we were an independent sovereign country, we'd be 43rd in the world, and the numbers go on. All of that was just an exercise to say, this is not a we and them, okay? We are not in the highly accomplished ivory tower looking down on the world. This is all of us, all the people of the world, and we're saying, what are our greatest challenges facing us today? And the way I'm going to do it is I'm going to give you the top 10 list, what I would call the top 10 list, except it's in no particular order except alphabetical. And I'm going to talk about these 10 things. I'm going to talk about death of children under 5. I'm going to talk about depression and mental health, environmental destruction, epidemic diseases, AIDS, tuberculosis, and malaria, human violence and war, lack of safe food and water, overpopulation, tobacco, unequal access to resources, especially healthcare resources, and so-called Western diseases or behavioral diseases. Don't worry, I'm going to go through these quickly. And what I'm going to do in each case is I'm going to tell you why I put it in my top 10 list. And at the end, I'm going to tell you what my top 3 are, my second, and my top choice. But before we do that, you have a chance to weigh in. Now, this is a little different, so don't vote yet. Really, this time actually listen to me. What you're going to do is you're going to look at this list, and you're going to pick the 3 things that you would rank on the top 3 of your list. And the way you're going to do it is you're going to press your button in, the green light's going to come on, you take your finger off the button, wait till the light goes out, then you can vote again. and you can repeat that. You can vote 3 times. If you vote more than 3 times, your first vote will be eliminated, and then your second one, and so on. So take a look at the list. Pick the 3 that you think are the greatest challenge to global health, and when I start to, you can vote now. Take your time. Up to 90, 95, 100, 112. This just tells me that you voted. It doesn't tell me how many times you voted for. And no, there is no way I can track who voted for what, though I'm told that technology does exist. All right, 129. Okay. Well, let's see what you guys think are the most important challenges facing the world today. Okay, interesting. Good mix. I like this. I like this a lot. All right, so 10% of you, 10% of you said that child death was in your top 3. 5% said depression. Environment got up there. Epidemics are up there. Violence is up there. Food and water is number 1. Population is high. Tobacco, access, Western diseases. Okay, a pretty interesting cross-section. We'll come back to this at the end, so you don't have to remember what you actually voted for. All right, now this is the meat of what I came to talk to you about. I'm going to try to present to you each of these issues, tell you why it's in the top 10, why I put it on this list. Can you all see that okay? Can you see my kids there? That's Gregory. That's Grant. That's their sister Kathleen down here. That's me. And in fact, this is sort of like a Where's Waldo game. On a lot of the pictures you'll see, try to find me. I'm in there somewhere. It's the guy with gray hair. Okay. You can't really look at pictures of kids and not sort of feel an emotion, whether they're your own kids or somebody else's. And so this is a really particularly difficult topic to talk about. But every year, about 11 million kids under the age of 5 die. To give you some context, that's about the entire population of Kentucky and Tennessee dying every year. To put it in a different context, that's the same as about losing about half of all kids under the age of 5 in the United States. In the States, we have about 20.4 million kids under the age of 5. Can you imagine the devastation that this country would suffer if we lost half of those kids in a year? And yet that's how many kids under the age of 5 are dying around the world. 1,200 young kids, that's under the age of 5, die every hour. Put another way, all the kids in this picture would be dead in 6 minutes. Put another way, in the time it takes to read this sentence, another child has died. That is an incredible tragedy, made worse by the fact that this is the causes of the death of these kids. About 2 million kids die every year from pneumonia. Most of them could be cured for drugs that cost less than $1. Between 1.5 and 2 million kids die of diarrhea, which for most of us is just an inconvenience. It, in fact, is one of the leading causes of death. About 1 million kids die from malaria. And altogether, they estimate that somewhere between 1/2 and 2/3 of all the kids who die under the age of 5 could be saved by existing low-cost interventions. Not something new, not something different. Vaccines, low-cost antibiotics, safe water, breastfeeding, sanitation, and so on. And so that's why I put death of children under 5 on my list of the top 10. How about depression and mental health? That was your lowest vote getter. And that's not unexpected. I would have been surprised had it not been. So why did I put it on my list? Most of us think of depression as a disease of luxury. You know, if you imagine someone who's depressed, I'm imagining something, I'm not saying this as a statement of fact. You imagine an American housewife, depressed, upset, sad, diseases of luxury, diseases of opportunity, things that really people in the developing world don't have the opportunity to deal with. In fact, in most countries in the world, less than 1% of their health spending goes to mental health issues. And yet, an estimated 121 million people suffer from depression in the world. Almost 1 million people kill themselves every year. Depression is the leading cause of disability after the age of 5, the leading cause. And of course, it impacts not just suicides, it impacts physical health. There's growing information about the relationship of depression and heart disease, depression and diabetes. It impacts on the families. You can imagine in the States, if a parent gets depressed, it's a problem. But imagine in a country where that caregiver is making the money that family needs to live on. And of course, it leads to substance abuse in numbers that we really don't understand. Depression was the 4th leading cause of disease burden in 1990, and by 2020 may in fact be the single leading cause of disease burden in the world. And yet most of us, most of you, didn't even think of it as an issue that we had to put on our top 10 list. Environmental destruction, on the other hand, is something everybody thinks about. You all remember Exxon Valdez. Some of you remember Bhopal, India. The rest are just pictures of everyday life. We're losing forests at a rate of about 144 square miles a day. That means we're losing forests in an area about the size of the state of Tennessee every 10 months. 3 million people are estimated to die as a result of outdoor air pollution, and about half that many, 1.6 million, as a result of indoor air pollution, most of them in the developing world. There's about 70,000 chemicals on the market. A little less than half of them have never been tested for their impact on people. As much as 1/4 of diseases are caused by environmental exposure, including about 1/3 of diseases of children. It's estimated that preventing environmental risks could save as many as 4 million kids a year. And so that's why I have environmental destruction on my list. The issue is this. We know we're doing damage to the earth. And that's not a political issue. However you define it, we know that's true. What we don't know is how much of this damage the earth can tolerate. And we don't know how much change in the earth is consistent with long-term human life. And if you think about it, we don't know what the early warning signs would be. What would we see if we were getting to the point where we had done so much damage to the earth that it was going to impact us in the long term? Well, epidemic diseases, most people when they think of global health think about epidemic diseases, AIDS, tuberculosis, and malaria particularly. I promised I wouldn't show any graphic pictures, and I won't. AIDS is a disease that was completely unknown before 1980. They now estimate that there are about 40 million people in the world who are infected with HIV. Almost 3 million people died last year. There are countries in sub-Saharan Africa where almost 40% of the adult population is infected with HIV. By comparison, the Black Plague, the bubonic plague that hit Europe in the 1340s and the 1660s, killed about 1/3 of the adults, 1/3 of the total population. Here's an epidemic disease that threatens to kill more than that and threatens to particularly wipe out the most productive age groups, people who are the leaders of communities. The impact of this epidemic is unmeasurable and at this point unknown. We know that there are already 10 million orphans in sub-Saharan Africa as a result of HIV, and the impact's going to continue. The real tragedy of this is that you've seen the papers recently. There are antiretroviral drugs out there that can prolong life by 2.5 decades. At this point, 85% of the people in sub-Saharan Africa who need those drugs aren't getting them, and they're going to die. 85%. Tuberculosis. It's a disease we don't even think about. You think about tuberculosis as being something that jazz musicians and mystery writers know about, but nobody else. In fact, last year, 1.7 million people died of tuberculosis around the world. At this point, 1 out of every 3 people in the world is infected with TB, and every second a new person becomes infected. Now, not everybody who gets infected gets sick, but if they get sick, they're going to infect 10 to 15 more people before they die. And the tragedy is about 85% of the cases of tuberculosis in the world today could be cured by drugs that cost less than $40. So we have 1.7 million people dying, not because they have a disease that can't be cured, but because they have a disease that's not being cured. And malaria, somewhere between 300 and 500 million cases of malaria a year. It kills about 1 million people, mostly children under 5 and pregnant women. Most malaria can be prevented. Much of it can be prevented with bed nets, residual spraying, treatment of pregnant women, and so on. I had malaria when I was 12. I'm sure many of you had malaria when you were younger. Not those of you from the States, but from other countries. To think that 1 million people are dying from this disease just adds to the impact of AIDS, TB, and malaria. And that's why those are on the list. Human violence and war. Something about human beings. In the 20th century, an estimated 190 million people died as a result of conflict. That number is almost unimaginable. Over half of them were civilians. We know from Iraq how difficult it is to count civilian deaths. The estimates range from 30,000 to 650,000. This is the best guess. Every year, about 1.6 million people die as a result of violence. But you know that's just the tip of the iceberg. Many, many more are physically, psychologically, and emotionally injured. We have no idea how many people are the victims of violent crime in the world. We have no idea how many women are raped, how many children are molested, taken in and sold as slaves. We just simply don't know. There's something about our species. Lack of safe food and water was the one that you all put at the top of your list and certainly belongs there. Most Americans today think of water as an everyday event, common luxury, and artwork. People forget that probably the single greatest improvement in health in the 20th century in this country was the accessibility of fresh, clean water. Probably the single greatest improvement. We tout ourselves on how much we've changed lives from improvement in medicine. Most of you know that they looked at the life expectancy improvement in the 20th century, and they found that about 16% of it came from improvements in curative medicine. The rest came from improvements in public health and preventive medicine, particularly clean water and refrigeration. Of course, most of the world doesn't have access to clean water. In fact, 1.1 billion people don't have clean water. 2.5 billion people don't have access to a toilet. Now, you think maybe that's a bit unsanitary. Just today I saw a report of a study in Peru. It said that a flush toilet increases by 60% the chance of a child reaching his or her first birthday. A comparable study in Egypt said it was 57%. Almost unbelievable. Something as simple as an ability to get rid of what is innately an infectious material. Each year, 2 million people die from diarrheal diseases associated with poor water. Food, of course, we don't talk much about famines anymore. We used to, when I was growing up, we'd always have famines. We'd have fundraisers for the famine and all of that. And I think most of us have tended to forget about the importance of food, but there are, in fact, 54 nations that don't produce enough food and can't import enough food for their population. 840 million people in the world are malnourished. 150 million are under the age of 5. Half of all deaths of kids under 5 are associated with malnutrition. And we call it malnutrition because starvation seems like an awfully harsh thing to say, but that's really what it is. not just death, but it impacts physical and intellectual growth. I remember a professor that I had in public health school named Dr. Claudio Schuftan, who said if the only thing that malnutrition did was give us short people, that'd be great because they eat less. The problem is it impacts their intellectual growth. It reduces their intellectual capability. So in addition to killing about 25,000 people a day, it impacts everybody that grows up with malnourishment. And so that's why food and water are on my list of the top 10. Overpopulation. Well, here's your opportunity to find Waldo in several places. This is the growth of the world's population. Easy way for me to remember. Since my grandfather was born, the world's population has quadrupled. Since my father was born, the world's population has tripled. Since I was born, the world's population has doubled after each of those previous advances. The population is estimated to rise to about 9 billion by 2050. We're going to add more people in the next 50 years than were added in the first 500,000 years of human history. And nearly half of all people alive are under the age of 25. And those of us that are not under the age of 25 still remember that that was a time of drive. We were going to accomplish something. We wanted the world. We wanted the opportunity. What's going to happen when we've got so many people with so little opportunity? We've already got 1 billion people who are living on less than $1 a day. A recent study came out that said that unless we change something by the middle of this century, fishing stocks will essentially be wiped out. There's no more water on the earth now than there was 2,000 years ago when our population was 3% of its current size. And I'm under 25 and I want my water. The world's grain harvest is expected to be 61 million tons short. Production has failed to meet demand in 6 of the last 7 years. And it goes on. And the issue is this: no one knows how many people the earth can support, and we don't know what the early warning signs are going to be when we've exceeded that number. And that's why overpopulation is on everybody's list. Tobacco. Well, maybe you think I'm picking on tobacco. I'm not picking it, I'm picking on it. Tobacco kills about 5 million people a year. More than AIDS, legal and illegal drugs, road accidents, murder, suicide combined. If current trends continue, there will be 1 billion deaths from tobacco in the 21st century. 1/2 of them will be people 35 to 69. So like AIDS, it's going to be hitting the most vulnerable age population. It will have a devastating impact on families, communities, and economies. Of people alive today, 500 million are going to die from tobacco. Now, all the numbers I showed you, the next one's going to stick with you. 10 million cigarettes are sold every minute. Unequal access to resources. This is the hardest one to define. Some people call it poverty, disparities, inequality, resource gap, inequity. We talk about the third world, we talk about impoverished nations, we talk about developing countries. What we're talking about here is the difference between what would happen if people had resources and what would happen if they didn't. 1/2 to 2/3 of all the deaths of kids under the age of 5 could be prevented by existing low-cost interventions. Those kids die not because those interventions don't exist, but because we can't get it to them. 85% of people in Africa, I'm telling you stuff I've already told you, do not receive the needed antiretroviral drugs, and they will die. About 80% of people who die from tuberculosis could have been saved with existing drugs. Accurate diagnosis and treatment of HIV and TB would save about 500,000 Africans every year. And the deal is this: there is a direct correlation between resources, defined by poverty, and health outcomes. Now, I haven't shown you any graphs until this one. And this is a little bit complicated. You can even those of you that haven't taken the gen ed curriculum can tell there's a straight line relationship. There's something going on here. Whatever this is impacting on that. All right? This is income. The poor countries are over here. The rich countries are over here. This is health. This is death of kids under the age of 5. In Sierra Leone, 300 kids out of every 1,000 are going to die before their 5th birthday. The top number up there, Sweden, it's 3. There's a 100-fold difference in survival of children based solely on access, resources, poverty. And it's interesting to note that the United States is up there and among the richest countries, but we certainly don't have the highest or the lowest, the healthiest measure, do we? So what does all that say? There's a direct correlation between resources, poverty, and health outcome. Western diseases, the so-called behavioral diseases, chronic conditions, lifestyle-related diseases. In the United States, 2/3 of people die from one of these 5 causes: heart disease, cancer, stroke, chronic lower respiratory disease, cigarette, lung, and injury. That's the United States. If you look at the whole world, you see pretty much the same thing. I highlighted in yellow those diseases that are lifestyle-related. You see the top 3. Cancers are split. There's some that are lifestyle-related and some that aren't. The bottom line is cardiovascular disease is the leading killer in the world. 29% of all the deaths, and 80% of them took place in low and middle income countries. For the first time, the number of overweight individuals around the world rivals the number that are underweight, about 1.7 billion. And incidentally, I use American billions and not British billions. 1 out of every 3 men in the world smokes tobacco. Between 80,000 and 100,000 kids start smoking every day. There's a lot to admire about our country, a lot to look up to, but there are a lot of things here that we wish the rest of the world wouldn't necessarily copy. So, that's my top 10 list. You might ask, why didn't I include aging? My gosh, that's got to be one of the major issues in the world, especially in countries, mid-developed countries, where suddenly the infant mortality rate has dropped, people are getting older. Why didn't I include cultural loss or cultural imperialism, the loss of culture, of traditional way of life? Surely that has a value to people and creates depression and mental health issues. Why didn't I include corruption and greed? Emerging infectious diseases, extremist violence, gender inequalities, international debt, lack of education, motor vehicle accidents that kill 1-some million people a year, and the unknown. Why didn't I include those? Because I only had a list of 10. I can only get 10 things on one slide. We could sit here together and talk about this and probably come up with a different list of 10. The unknown, by the way, isn't a joke. I mean, the unknown, AIDS was unknown in 1980. Just today there was a report that maybe about 5,000 years ago, a meteor struck the Atlantic Ocean and created a tsunami 13 times higher than the one that hit Banda Aceh. That'd be unknown. So I just had to pick 10, and I picked the ones I picked. And I hope each of you would pick something different, because each of us brings our own perspective to this. But here we are, back to the list. And so let's vote again. Same instructions as before. Get your clickers out. Think about what I've said. Think now not about them and us, but think about all of us. What do you think is the greatest threat to your health? The greatest threat to the health of everybody living in the world today? What are the 3 things up there that you'd get rid of first, if you could? And final exams are not up there. You ready to go? Okay, here we go. 117, 119, 121, 23, 24, 5, 6, 3, 2, 27. 2 more people. 28, 29, there it is. Anyone else? Excellent. All right, let's see if anything changed. Wow. Well, let's see. Water, food and water still leads the list. Where did we go? Let's go back to the previous one, see if this works. All right, before, our numbers were a little more diverse. What do we see? More people are going with food and water now. You know, it's much more evenly divided than it was. I don't know what to interpret. Well, let me tell you what my top three are. Number three, I'll put environmental destruction. I think there was a reason that primitive societies worshipped the earth, why we talk about Mother Earth. It's the only place we've got. If we do damage to it, as I said before, we simply don't know. And we simply don't know at the point at which we will have crossed that line. And so for me, that makes it the one that I worry about third most. Number two, overpopulation. Many of the issues on this list are related to overpopulation. For those of you that are scientists, you'll recognize the Petri dish. We all intuitively and instinctively understand that a Petri dish can only grow so many bacteria before all the nutrient capability is gone. The problem is we don't know precisely how that's going to play out for the world. And I worry about that. And number one, for me, you like that? It gets bigger. Number one, unequal access to resources. Why would I say that this is the leading health challenge faces the world today? You're going to think I'm crazy, but I say it first and foremost because it is fundamentally wrong. There is not a single religious, moral, or ethical paradigm that any of us know about that says that it's okay for one group of people to let another group of people die solely because that other group is poor or lives in another part of the world. I want to ask you to do something for me. Think if someone came to you and said, you have a terminal disease, and the treatment, the cure exists, but it exists on that side of the room, and you can't get it. And what if I said to you, no, it's not you, it's your child? And what if I said it's not you, it's not your child, it's the children of everybody in this side of the room? And that side of the room has the drug. We've never lived in never in the course of human history have we ever had this situation. The wealthiest kings of France were not as wealthy as we are today. There has never been a situation. And I wonder how long the people on this side of the room will stay on this side of the room and not come to this side of the room, because fundamentally it's wrong. There's not a single justification that anyone can come up to me with. I'm not talking about everybody having a car. I'm not even talking about everybody having an education. I'm talking about everybody having a life. We're letting people die solely because they are poor. And that's fundamentally wrong. It may surprise you to know I'm not a socialist, I'm not a communist, I'm not a Republican, I'm not a Democrat, I'm not anything. This is not a political issue. This is an issue of basic human ethics. The second reason it's my number one choice, and maybe why it went ahead of the others, is it's something we can address immediately. We're not talking about drugs that we need to invent. We're talking about things that already exist. We can change people's lives right away. And frankly, the consequences of ignoring it are simply too great. There are millions of people who are dying every year, not because they have a terminal disease, not because they have a terminal disease that doesn't have a cure, but because they have a terminal disease and they can't get to the cure. And I ask you this, think about this for a second. How will our great-grandchildren and their great-grandchildren judge us today when they look back at us and they say, wait a minute, how did you guys live in a world where you knew there were millions of people dying, and you knew that the interventions to save their lives were there? I think they're going to judge us harshly. I think they're going to judge us the way we judge our ancestors who did things that we don't find morally acceptable. The consequences are simply too great. Okay, I'm going to motivate you to address these issues. What can you do? You think, oh my gosh, there's so many things. There's really only two things you can do. Don't worry about it. I'm almost done. And I'm not going to have you vote on them. There's really only two things you can do. You can act. That is, use your skills and passion to directly help other people. If you don't have a skill, you can get one. You can study medicine, you can study nursing, you can study engineering, you can learn how to build houses, you can learn how to build wells. You can study public health. You can study public health. You can study public health. All right? That's the first thing you can do. You can act. You can make a difference in people's lives. But you can also advocate. You can use your skill and passion to convince others to make a difference. And who are others? Others are university, ETSU. Others are your neighbors. Others are your church. Others are your country. Think how much Bill Gates and Warren Buffett have done to improve global health. I will tell you the United States is infinitely wealthier than those two men. Infinitely. We are the United States. We can make a difference. The one thing we can't do is we can't ignore it. The consequences of ignoring it are simply too great. I want to thank you for your attention.